similar title is Cervical Laminoplasty using movie cutting space for treatment of cervical Myelopathy. Speaker is Dr. Hisashi Koga from Department of Orthopedics, EY Orthopedic Medical Hospital. Please, Dr. Koga, start your lecture.
Everybody, how about the taste of the Japanese lunchbox? Also, not only taste, but looking for the beautiful flavor of the lunchbox. And today's my talk is a little bit difficult to understand the field coming from other areas, such as engineering and other medical field, because this topic is very specific field of the spinal surgery. And that's why I divided today's talk to three parts. First, I want to explain the disease, which is called cervical myelopathy. And using the anatomical aspect and the pathological aspect, I will explain this pathology for cervical myelopathy. And next, I want to explain the treatment, surgical treatment is called cervical laminoplasty. And this surgical procedure is developed in Japan, and there are so many history of Japanese spinal surgeons. That's why I want to also explain this development of cervical laminoplasty. Lastly, I want to explain the clinical experience for using laminoplasty basket, which is newly developed special for this for cervical laminoplasty, and lipid, which is artificial bone. Previously, Mr. Shoji introduced the material. And this illustration is cervical region in the lateral side, and yellow is nerve system. And here is the cerebellum, and this is the spinal cord. Spinal cord through the spinal canal. Spinal canal consists of bone structure, and this is the vertebral body, and also vertebral arch. And between this bone structure, spinal cord through the down road to the body. And also between the bone, there are two ligaments. One is the anterior ligament, and the other is the yellow ligament, located posterior. And also there are this structure. That's why if this surrounding structure is changed to the degeneration, it will be occur narrowing of this spinal canal. And finally, spinal canal was compressed by the degenerated surrounding structure. It's called myelopathy. This is the cross section of the spinal cord. This is the anterior part. This is the posterior part. This is the lateral part. And the spinal cord is consists of main two tracks. One is the ascending tract, the other is the descending tract. Ascending tract is conducting the sensory to the peripheral to the brain, and descending is conducting the motor function to the brain to the peripheral muscle. And that's why ascending tract is located dorsal part of the spinal cord. And this area is very weak to the damage. That's why patients first occur the numbness and the pain of the extremity, and then secondly occur the sensory disturbance of this incision. Then motor function is disturbed by the disturbance of the descending tract. And next occur the disturbance of skill movement. Skill movement is is a function by the coordination of the ascending and the descending tract. That's why after disturbance of both tract, disturbance of skill movement will be occurred. And then muscle will be atrophied, and then finally patient could not walk, and blood and bowel dysfunction will be occurred. And there are several reasons for myelopathy. Most genotype is spondylosis. Spondylosis is the aging change of the surrounding structure. For example, some patient is ligament will be degenerated and thinning, thickening, and also bone structure will be degenerated and make an osteophyte. Osteophyte is some protrusion of the bone, and then spinal cord will be compressed. And second reason is ossification of the posterior longitudinal ligament. Posterior longitudinal ligament is located here, anterior part of the spinal cord. And this abbreviation is OPLL. OPLL is very common disease in East Asia area, our area. And not only one genetic change. At the moment, 5 gene is the changing of the 5 genes is correlated to this OPLL. And also OIL, this is the ossification of yellow ligament. Yellow ligament is located behind of the spinal cord, and that's why if ossification of this ligament will be occurred, the spinal cord is compressed from the posterior part of the spinal canal. Also, the degeneration of disc is occurred in myelopathy. This is a very rare case. Some patient is very young. This patient is congenitally spinal canal is narrowing, and then the spinal is called developmental spinal canal stenosis. And this is also cross section of the spinal cord, which suffers spondylosis. And this section is hematoxy erosion staining. This purple area is cell is not degenerated, but white area is degenerated. This is the posterior area of the spinal cord. Previously, I explained posterior part of the spinal cord is easy to damage by this pathological status. And also, this is a GFAP, glial fibrillary acid protein. This is also main protein for the neurons, and glial fiber. And that's why this white area is a damage for the glial, also glial, not only cells, but also glial fiber. And next one, I want to explain the cervical laminoplasty. Yeah. And cervical before development of cervical laminoplasty, the patient is treated by laminectomy. Cervical laminectomy is remove the more wide area of the bone. That's why sometimes occur the adhesion of the spinal cord to the surrounding tissue, remain surrounding tissue, and also too much bone resection occurs deformity of the spine after operation. That's why operative outcome is not sufficient. But after 1970, very good high-speed surgical bar had been developed. Using this kind of surgical bar, we can make a new operative method. It's called cervical laminoplasty. And this procedure is, especially in Japan, and developed, but gradually spread to the world. And after 2000, less invasive laminoplasty had been developed. For example, small skin incision and the preservation of the muscle structure. This kind of operation increase the operative outcome and also reduce the pain, post-operative pain of the patient, and less deformity of the post-operative spine. This is a figure of the laminectomy. Laminectomy is to remove the large area of the bone. That's why spinal cord is exposed to the outside and it's easy to occur scalp formation. This is a surgical bar. You can see this kind of instrument in the dentist for the teeth. And using this kind of bar, we can make a gather to the bone. That's why we can, it's not necessary to remove the whole of the bone, only making a gather and making open the enlarged spinal canal. And first, Oyama and Hattori proposed laminoplasty. It's called expansive Z-shaped laminoplasty. I did not show the detail of this plastic, but immediately after, Hirabayashi developed open door laminoplasty. This is now it's procedure very common for the laminoplasty. And this is the explanation of the open door laminoplasty. This is the spine. We can see the spine from the back side. And we did make two gather both sides of the spinous process. And one gather is completely remove the bone and open the spinal arch to the other side. After that, this is the spinal cord. Spinal canal is enlargement by this movement. This is a photograph of Hirabayashi. He is developed this method. He was working in the Keio University, very famous university in Japan. And now he is working in the Gunma Prefecture in the private hospital for the honorary director. 1984, Dr. Kuga, who is a professor, who was a professor of Tokyo University, he did the French door laminectomy. French door means the bilateral opening of the spinous process. And after opening the spinous process, it's necessary to press the spacer, which continue to the opening condition. For example, split the spinous process and then press this kind of spacer. And Kroger are using this spacer for this part of the spinous process. But now we can use several material for these spacers. It's also called in Japan, it's Kannon opening. Kannon means this is a god of mother. Her hand is like this. That's why we call the Kannon opening. This is a photo of the Professor Kurokawa, but he already died. And after 2000, less invasive procedure was developed. For example, spine had so much attachment of the muscle. That's why preserved muscle is very important for prevent spinal deformity after operation. That's why now we are doing preserve this kind of muscle using not only this kind of bar, but also microscope. And especially Dr. Shiraishi developed this kind of procedures. And in Japan, not only we develop a procedure, but also develop material, such kind of spacer. There are so many types of spacers in Japan, and also several different material. Most popularly used material hydroxyapatite. And the laminoplasty plate is the first produced flexible titanium plate. This is completely different to this kind of space. This is the laminoplasty plate. This is there are several types of laminoplasty plates. Depending on the patient or condition, we will use different lengths of the spaces, and also different type of the. This is a hole for the screw. We can use several types of screw. And sometimes using this kind of French door, we can also use the open door. And also there are space for the introduce the artificial bone. And the characteristic point of the laminoplasty basket is, first point is this is made from titanium. Titanium is very easy to integrate to the bone, and also very less artifacts. That's why after doing this operation, we can take a CT and MRI clearly. That's a good point. And next point is it is possible to combine the bone graft using this side. This is the previous type, especially used in America. This type of braid cannot introduce artificial bone. And also the characteristic point is very easy to bend this area. That's why we can use this basket plate for not only open door but also French door. This type is previously using a titanium plate, is only using for the open door operation. And previously showed that this is artificial bone. This is a combination of hydroxyapatite and collagen, and very, very soft. And we can use the change of form only pressed by the forceps. That's why we can